about the quality metrics that you talked about in terms of healthcare facilities and communities. You will be relying on a lot of community information in terms of quality of healthcare, in terms of making your decision as to who in the private sector would deliver care to a veteran if the veteran couldn't get the care from the VA. Is that correct?
Yes.
Are the quality metrics available today in a seamless standard format?
Here's what we have available today. As you know, we've recently published the wait times of our veterans that are on the website right now. The VA is ahead of the private sector on that. We hope the private sector will follow our lead and begin to start publishing wait time data. So we have VA data, but not public data. What we do have for both the VA and the private sector are patient satisfaction scores called CAP scores that are the same surveys in the VA and outside in the private sector. And we do have quality metrics. We have quality metrics for inpatient care, where there are more metrics in the private sector and the VA. But what we're really doing now is developing those metrics, and so is the private sector, for ambulatory care. So between all of those measures, there is enough to make the types of comparisons we're talking about. And it's only going to get better over time.
An eligible veteran comes to the VA for health care, and the VA clinic that he goes to that's near him, or the hospital that serves him as a veteran, doesn't offer that service, whatever it might be. That automatically gives him the opportunity to go, or he or she to go to the private sector and community care. Is that correct?
It does, yes.
Secondly, if the community quality rating is not good, does that automatically give them a chance to choose community service, community care, rather than go to the VA?
What we're doing in this program, we are designing it to be that way. We want to make sure that if the service is low performing, if it's below what the veteran could get in the community, that they have the opportunity. They don't have to leave the VA. They're given a choice so that they are able to get care in the community or stay at the VA. Because you know, if a veteran has a good experience and they have trust in their provider, they're going to want to stay where they are. So, but that is the purpose. The whole idea here is to improve the VA, not to get more care in the community. And the very best way that I know how to improve health care is to give the patient, in this case the veteran, choice, and to make those choices transparent, to let everybody see. Because then, if you're not performing as high a quality service, you're going to want to provide a higher quality service because you want to be proud of what you're working on. And I want the VA to be improving over time, and I think this will help us do that.
You tell me, Dr. Yahi, if this is the correct statement or not. Under the old system, we set in an arbitrary qualification to use the community care to be the number of days you had to wait for an appointment or the number of miles it took a canary to fly from where you lived to where the clinic was available. Is that not correct?
That's right.
Now we're talking about a judgment call made as to whether or not a veteran who's eligible for VA health care can go to the community care servant or go to the VA. Is that correct?
That's right. We're empowering the veteran and their care team to make those decisions rather than having arbitrary administrative rules.
But there is going to be, somebody at the VA is going to be a part of that decision. It's not going to be just the veteran making that decision. They're not going to go to the community care alone. Who is that person in the VA that makes that decision?
Their doctor and the care team that supports them.
So the doctor and his doctor at the VA is the person that will ratify his decision to go to the private sector based on or go to community care, based on the fact either the quality metrics in the community or based on the fact they can't offer the service that the veteran needs. Is that correct?
That's right.
Do you consider that as a, I'm going to take a little bit more of my time, but this is important. Do you consider that a threat to you, doctor?
No.
You're a doctor. David,
Yeah.
you are too. And
Well, I think patients come to doctors to get a clinical assessment and to get their advice. That's how we're trained as we go through medical school. So it's our responsibility to have those conversations, figure out what makes sense for them. And so the advantage of the CARE program compared to the Current Choice program is it helps us decide the right place, the right doctor, and the right location, and the right time for that patient to get their care. So I actually think it's going to empower doctors in the system and patients in the system to make decisions that make sense for them.
I want you to listen to this. And I would assume veterans who are otherwise eligible for VA health care but are not using it because they got private health insurance or something else, would be more attracted to come to the VA for their services because you've got that choice and it's made in the way it's made.
Yeah, in some circumstances, we've been seeing, as you know, if you build it, they will come. More people are interested in receiving VA health care than before.
So the concern that some might have, that this is a threat to VA and VA healthcare, it in fact, in many ways, is going to put an additional pressure on VA and VA healthcare to provide services to a greater number of veterans. So, because I happen to agree with Senator Tester. None of us sitting at this table want to dissolve the VA, do away with VA healthcare, or close anything. On the other hand, we don't want to perpetuate a problem. We're trying to solve what has been a huge problem, which we couldn't solve 27 months ago when we kind of cut and run on it. Now we got the chance to do it. So no, we have no goal whatsoever to reduce the role of the VA healthcare system in the life of a veteran or take away or close a single clinic or a single facility. We want to make sure that we have the best service available to the veteran. And if we do that, if you build it that way, talking about the system, they will come and the VA will be even more, have an even brighter future than it's got today as well. So I appreciate the response to that. Senator Tester.